I'm from an organization called Cell Life, based in South Africa. The area that I work in is mHealth. That's the use of mobile phones in health, particularly in a developing country context. In a country like South Africa, we have like 80 or 90% of people with mobile phones, yet we have about 10% of people with access to the internet via computer. So if we're really looking at how to provide better healthcare, and especially more connected healthcare, we have to look at using mobile phones. There's just, in a country like ours, there's no other way of doing it. So it's for things particularly around health promotion, disease prevention, but also disease management. I would say the biggest key challenge that we face is going to scale. So that's really moving projects into national level implementations. In terms of the solutions to that challenge, we're really looking at public-private partnerships to try and access more money and more skills to take our projects to a larger scale. We're also looking at doing studies to gather more evidence, because in the end the evidence is going to show whether it's worth going to scale with these kinds of projects. The last thing we're doing is really looking at trying to build capacity in government. In the end, to truly go to scale with using mobile phones in health, the government has to look at making this part of standard of care. So we're working on trying to get government to see the potential and see what truly can be done by using mobile phones in health. We've done, for instance, using SMSs to try and get people to test for HIV. We're also using SMS to try and get people to adhere to their medication, because ARVs are a very long-term medication that people are on for life. And there's a lot of barriers to actually staying on that medication. And it's a medication that you have to take at the same time every day. So what we really try and do is address the barriers to medication adherence through messaging. We're also going to be doing a really great project in the next year where we'll be providing information and support to women who are pregnant and in the first year of the child's life. Because South Africa has a very high maternal mortality rate that's actually in fact been getting worse. And we're really looking at how we can use mobile phones to try and empower and educate women to try and deal with some of the issues that they face during pregnancy and with young babies. I would say that I'm finding in the sessions that I've attended is that really the challenges across countries are very similar, and that we really have a lot to learn from each other.